the CAE now. Laura Dickson, she's gonna be talking to us a little bit. So this is the Canadian Epilepsy Alliance leader. Laura is the president of the Canadian Epilepsy Alliance, an alliance of 26 member associations offering epilepsy support and education within local communities across Canada. Laura also leads Epilepsy Association of Calgary, a position she has held since 2019. Her work in advocacy and in neurological health space also extends further at the national level, where she serves as Director of Neurological Health Charities of Canada, a members-based coalition focused on patient advocacy. Laura's nonprofit career is complemented by senior policy and planning roles in the public and healthcare sectors in Ontario and Alberta. She holds an MBA in Executive Leadership from Royal Roads University, a BSc from University of Toronto, where in 2017 she was recognized as Alumni of Influence at University College. Laura also holds a post-degree certificate in health promotion from Candor College in North Bay, Ontario. Laura, thank you.
Good afternoon, everyone. It's an honor to be here with you today at the CLAE 2025 Scientific Meeting. I'm speaking to you as the president of the Canadian Epilepsy Alliance, a national alliance of 26 community-based organizations working across Canada to support the 1 in 100 Canadians living with epilepsy and their families. Today, I am joined by a few of my colleagues from Newfoundland and Labrador, Epilepsy Ontario, South Central Ontario, Timmins, Ontario, Saskatchewan, and myself, based right here at home in Calgary. We are a network of organizations working at the local level, but our reach is national. Our strength lies in our geographic diversity, our local connections, and we count many with lived experience among our leadership. Our shared commitment to improving lives through education, advocacy, and support is the goal that unites us. Together, we amplify the voices of our communities and bring their needs to the forefront of national and international conversations. Today, I want to highlight some examples of collaborations that strengthen our collective impact in service of individuals and families impacted by epilepsy. We owe it to the community to demonstrate our willingness to work together as patient advocates, industry, clinicians, and researchers. Let's begin with research. Research brings hope and opportunity, whether to participate in clinical trials or knowing there are developments on the horizon. The Canadian Institute for Health Research's patient engagement framework has generated connections. We see clinicians and researchers increasingly seeking our input in meaningful ways, not just as participants, but as partners. Our member organizations help shape research priorities, co-design studies, and ensure that these findings are translated into meaningful change. We believe research must reflect the lived experience of people with epilepsy, and that means asking the right questions, not just about seizure control, but about quality of life, stigma, mental health, and access to care. We are proud to support and elevate research that is inclusive, community-informed, and action-oriented. Let's talk next about collaboration that supports our community to become better advocates in safety and risk reduction. This year, we joined forces with Epilepsy Canada for Suit Up Action Day. Together, we raised national awareness about sudden unexpected death in epilepsy, a risk that remains too often in the shadows. Our joint campaign shared facts, personal stories, expert guidance, and we called upon families, clinicians, and policymakers to talk openly about Suit Up, to ask hard questions and advocate for proactive care. This partnership exemplifies what's possible when organizations put aside past differences and unite around a common cause that is a priority of our community. We look forward to continuing to work closely with Epilepsy Canada on public education here in Canada and with the International Bureau for Epilepsy on global matters concerning patient needs and rights, and with the CLAE on clinical and policy issues. These relationships are helping us build a more connected, credible, and consistent epilepsy movement in Canada. Access to treatment is a cornerstone of our advocacy. This year we celebrated a major milestone with public access to cenobamate. This was a hard-fought win made possible by collective voice of our community. We continue to monitor and respond to medication shortages like the clobazam supply issues. We know there is work to be done in advocating for equitable access to therapies for rare epilepsies and for timely, effective, and affordable treatment for underserved populations and people facing barriers, be they cultural, geographic, or otherwise. As part of the IBE's Global Epilepsy Needs Assessment looking into predominantly unmet non-medical needs for individuals and caregivers, we have directly supported the generation of Canadian data and perspectives that highlight key priorities in epilepsy care and advocacy. Basic seizure first aid education must be widespread and accessible. Clinician education must include the broader needs of people with epilepsy, mental health, social inclusion, and stigma. Emergency response protocols must be appropriate and consistent. And of course, stigma remains a major barrier. Timely access to treatment and integration of mental health care is essential. And we must never forget the risk of injury or death, including SUDEP, which demands urgent attention. Each of these calls to action reflect the lived realities of people we serve. And later this year, we will support the IBE as it embarks on phase 2 of GENS, looking at the special needs of women caregivers and those who are living with rare or complex epilepsies and the needs of people living in lower socioeconomic communities. To look at one example of work led by one of our members, we can see how provincial leadership can drive national progress in epilepsy awareness and support. Policy Program Memorandum 161 is a landmark directive from the Ontario Ministry of Education that mandates all school boards to implement policies supporting students with prevalent medical conditions, including epilepsy. For families and parents of children with epilepsy, this memorandum is profoundly significant. It ensures that their children are recognized, protected, and supported within the school system. PPM 161 requires the development of individual plans of care, fostering collaboration between families, educators, healthcare professionals to meet each child's unique needs. It promotes a whole school approach to safety and inclusion, helping to reduce stigma and improve understanding of epilepsy among peers and staff. This policy empowers parents to advocate for their children's well-being and ensures that epilepsy is no longer overlooked in educational settings. As we look to the future, we are inspired by initiatives like Bill S-494, a National Plan for Epilepsy Act, inching its way forward in the United States. This is a compelling story of collaboration within a fragmented field of contributors. This effort is a coordinated, multi-sector strategy that addresses research, care, education, and equity. Down the road, securing a commitment in the form of a national plan, strategy, or task force may present an opportunity for community-based supports like those offered by each of our 26 member associations to finally receive the recognition and financial support needed to continue filling a critical gap in supports, connection, and education. Such bold action prioritizes epilepsy, one of the top 5 most common neurological diagnoses in our country today, setting the stage where every person affected by epilepsy feels seen, heard, and supported. Last, to the clinicians, researchers, and partners in this room, thank you. Thank you for your dedication, your curiosity, your compassion. The Canadian Epilepsy Alliance is proud to stand beside you, not just as advocates, but as collaborators. Please drop by our table this weekend, and this is how ideas get started. Let's continue to build the future of epilepsy together, and I wish you a very successful 2025 Annual Scientific Meeting.